I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor. Welcome to another episode of Women's Health Unplugged. I am really excited to be joined today by one of my really good friends and colleagues, Dr. Alison Danby. I've asked Alison to come on the podcast because she has this domain expertise that I just don't have. I really shied away from looking at and supporting and treating autoimmune disease in my practice for a number of reasons, which we'll talk about, I'm sure, over the course of our time together today. But Alison is an absolute expert on this topic. She has taught clinicians inside my clinician group on autoimmune disease and is continuing to push the needle forward as far as what integrative practitioners can do for autoimmune disease. Alison, thanks for joining me on the show today.
Thank you so much for having me. I'm excited to be here.
I am excited to have you too. And it's funny for us to do this podcast, how we are, and both of us, like in sort of our work attire, we have spent many weekends together cottaging and hiking, and we share so many common interests like cottaging and dogs and whatnot. So it's funny to me that we're like, we probably should have done this over a cup of coffee at the cottage, honestly.
Oh, we totally should have done that. That would have been on the dock or in the sauna. That would have been fun. Yeah.
So, and I want to start, and I know your story so well, but I want you to start by sort of walking our listeners through how you got to this spot in your career where you are so passionate about supporting autoimmune disease. I think it's helpful for listeners to understand like how our guests got to this place where they're so passionate about it. There's often that sort of personal story or that personal connection for why practitioners get so attached to particular areas of medicine. Can you walk our listeners through, like, first of all, who you are and how you got to this spot in your career where you really are so focused and interested on autoimmune disease?
Absolutely. So I used to be a high school math teacher turned naturopathic doctor. And so education's always been a huge component of my life, which kind of has led me to where I am now. But during my naturopathic career, I developed Hashimoto's in my last year of school is when it kind of flared its ugly head in my first year of clinical practice. And for me, that was a journey that I thought I was ready and equipped to take of, just graduating, here we go, let's put this to work. And it was an extremely frustrating journey with the medical community that I was working with. And the gaps that I had in my knowledge was so evident at that point. So it took me a good 2 years to really get a handle on it, to really settle it down with medication, and knock on wood, I've got it settled, but that actually wasn't what got me into autoimmune because I had a lot of shame around that. Being a healthcare practitioner and being sick, I wanted to keep that quiet and in the dark. But it was when patients of mine, in probably fast forward about 8 years from that event, patients of mine were coming in and telling me about their experience. And I knew it because I had been through it. And it's frustrating, and we're up in Canada. And so our doctor appointments are a little bit different, just not as advanced. And one of the things that I found with a lot of my clients is they're coming in and being told, well, there's nothing else you can do, just take this medication. And I understood where the doctors were coming from because that's what their reality was, and that was what their education was, and this is what their skill set says. And yes, there is definitely, you need to be on medication because it is a very dangerous, or it can be a very dangerous condition with a lot of damage. But at the same time, I knew there was so much more that we could do to, one, help with the quality of life. And so that's what really helped me, or got me to dive back into it, is knowing that I understood the journey, and it's frustrating and it's up and down. And one of the things with the autoimmune journey is there really is no endpoint. Right there, it's something that we essentially live with for life. And so there's a big grief component to it and a lot of fear that is involved with it in that emotional journey. And when you're not getting a lot of answers, and now you go online and oh my goodness, you're so overwhelmed with what's out there and what is true and what is not true. And so that's where I tell a lot of people I'm their Sherpa. So I help them, I guide the journey and work with them. And for some people, we take the scenic route and work on some of the lifestyle changes and all the things that can really move the needle while you're medicated and help improve quality of life. And just, it's all about keeping your energy up, your mood up, and all those different things that can make a really big difference in how you're performing day to day.
And so when we say autoimmune, like we're talking about a lot of conditions. Can you give us some examples of when you're using that word autoimmunity and we're talking about, fatigue and quality of life and whatnot, like what conditions are you referring to?
So, well, there's like 150 different autoimmune conditions. Some of the main ones that I work with are lupus, RA, rheumatoid arthritis, psoriatic arthritis, Sjögren's, what else? Hashimoto's, Graves. Those are the most common ones, I would say. I see a lot of unusual ones as well. Those are the ones that have the most research behind them too. And because they're the most common, they're talking about a lot of women's health ones. I'm just trying to think of what else I treat a lot of. Those are the big ones. Those are the really big ones that I find that I see most of my clients, probably more than 80% of my clients are those ones.
And the commonality then between them, like how come we can talk about them in some of those general terms?
Oh, so with the lifestyle factors and all that. So there is a lot of common and overlap between the autoimmune conditions. So one is inflammation is at the root of almost every single autoimmune condition. Oxidative stress, which is aging, and that fuels inflammation. And so when your body has, oxidative stress, for those of you that don't know what that is when you have the avocado that is browning, and that is just that aging. So apples do the same. We see it with wrinkles, we see it with cholesterol. So all those different things are signs of aging. And so that just fuels the inflammation behind it as well if you have an increased oxidative stress. And that's actually, interesting enough, where a lot of the future of autoimmune medicine is going to, is looking at how can we use oxidative stress as a biomarker of progression of disease, because inflammation is part of it. But ultimately, it's the immune system that has, for some reason, and there's many different theories out there, has now seen part of yourself as a problem and has now created a memory of that receptor or whatever it is that is attacking, and has created this inflammatory immune response to that area. And that's essentially the common thread between them all, is the immune system inflammation and oxidative stress. It's just picking different spots to attack in the body, essentially.
Right. And so partly why we can talk about these conditions kind of grouped together. It's interesting because, like, sort of from a physiological level, there are some very similar things that are happening, maybe with a different target tissue, but then the patient journey and the patient experience is actually kind of similar, regardless of which autoimmune condition we're talking about. We talk a lot on the podcast about like diagnostic lag times and how long it takes for us to find things in healthcare and in women's health specifically. And autoimmunity seems to be no different from my experience, where, from that first moment where someone's got some achy joints, or that first moment where they're realizing that, their sleep is not restorative, or they've got skin changes that are kind of new, it can take years, and even in some cases a decade, for us to realize, acknowledge, correctly diagnose, and then begin treatment for those patients.
Absolutely. And that's definitely something that I talk a lot of my patients about. I get a lot of people that are diagnosed, some people that are kind of diagnosed, or you're trending in that way. It has gotten better. So I think it was about 10 years ago, it was 10 years to diagnose, 7 to 10 years to diagnose, and 20 different doctors. Now it's down to 4 years is what the research is supporting. And I think it's less than 10 doctor visits to get that diagnosis. So it is improving, but we still have a lot of people that are kind of in this in between. They know they have an autoimmune genetic predisposition in the family. They're worried that this is going to turn into an autoimmune condition. And so we have certain criteria that it has to meet in order to get that diagnosis. And there's a reason for that. Is because the solution is like a bazooka. So they want to make sure, so by the time you get onto those pharmaceuticals, they're aggressive and they have a lot of side effects, but are so needed, especially when you're at that point in your journey. Now, there's so many different things. And this is what I love when I'm getting clients that are just starting to get that fatigue, that are just starting to notice the mood changes or the aches, because there's so much that we can do to help mitigate and possibly slow down that diagnosis with the lifestyle changes. And we can talk about some of them today because there's some really important ones. But what we tend to see is for a lot of people, there's a couple of things that we see kind of pre-autoimmune condition diagnosis that may head us into that direction. Is one of them is like a Raynaud's syndrome. So a lot of people, and almost every single patient that I have in my clinic right now that I've talked to, of like, what were the signs that you first noticed? Sleep changes, fatigue, and Raynaud's syndrome. So almost like the cold hands, the cold feet, extreme like thickening of the blood. They may have noticed blood sugar changes as well, cholesterol changes, but those are the three: the fatigue, and the insomnia, and the Raynaud's syndrome. And for a lot of people, we have reasons why we would feel that, or we assume it's the thyroid. So we're investigating, or iron levels, but we're not really investigating. But that's when we can get them from an integrative, from a naturopathic care, and make such an incredible difference with lifestyle changes, looking at the risk factors and reducing those risk factors. One of the really interesting risk factors that I came across in some of my research is showing that people that consume, just one second, I got it right here written down because I knew I'd forget this number. People that consumed over 100 grams of fish per day, which is a lot of fish, actually reduced the risk of rheumatoid arthritis by 15%. So a simple little diet change like that can make a huge difference, reducing the red meat and reducing your risk of developing rheumatoid arthritis. So can you imagine if instead of this wait and see, we have people coming into us and we can implement all of these different lifestyle modifications where we get you sleeping through the night, you're getting that restorative sleep, reducing that central nervous system that's upregulated and that's connected to the adrenals, and just making some of the simple little diet changes. It doesn't mean drastic diet changes. In fact, the research doesn't even support that for autoimmune at the moment. So there's so many things that we can do that may prevent you from getting to that time of diagnosis, or at least give you that hope of, I'm doing something. Because it's the wait and see for a lot of people that's like torture. I remember I was given, my dentist told me, well, we just have to wait and see if you're going to have a root canal. I'm like, oh my goodness. Like that was flooring for me because I didn't want a root canal. And turns out it wasn't that. I got a second opinion. It wasn't that. And they fixed the problem, and knock on wood, haven't had to have a root canal. But that wait and see for a lot of people is what really triggers that, the changes, the depression of like what is happening. But there's so much we can do.
One of the things that I've struggled with, like specifically around this topic of autoimmunity, and maybe why partly I've shied away from it, is that when I, graduated from school and was looking at all of these various areas of medicine that I could maybe spend some time focusing on, I felt like the culture, like the wellness culture around autoimmunity, was really not that well-founded from an evidence-based perspective, but it also felt like this insurmountable culture that if I was going to come in and say, actually, guys, like, I don't really think that, X, Y, and Z is that evidence-based, that I was never going to overcome that mountain. I'm really pleased that you are trying to overcome that mountain.
Scary.
But what I'm talking about specifically, just if as a listener, is if you've ever hopped online and looked at some of the content around autoimmune disease, the things you're going to find is like restrictive diets. You're going to find this like relentless pursuit at trying to figure out why you got your autoimmune disease in the first place. So the pursuit of the root cause, we'll call it, and endless supplement lists that, are supposedly going to help reclaim your immune system and cure you from your autoimmune disease. And, at the time when I was looking at areas in medicine I wanted to focus on, I was like, I don't actually think any of those things are true. And I don't know how to be the autoimmune practitioner that is so counterculture to that wellness industry. I probably played it safe and joined the women's health entourage as a consequence of that. But Alison, like, how do you manage that? So let's talk about that root cause piece for a second. Like, why are people so worried about what the root cause of the autoimmune disease actually is? Like, where does that stem from?
I think a lot of it stems from functional medicine. There may be people, and I do know this. So for some people, it is really easy to find that root cause. I've had autoimmune people where we're not necessarily looking for the root cause, but when you're doing a really good health history, and this is one of the big differences too, I think, is I unfortunately just had a horrible initial appointment with a medical doctor last week that was 3 minutes long and maybe 3.5 minutes. And when I look at what I do with a patient that is an hour and diving into the health history, there may be something that is so obvious that this is what's causing your immune system and that we can then fix it. And for some people, it is doable. That is not the norm. That is definitely not the norm. That is like, I don't want to say unicorn because it does happen, but that's the platypus out there. Like there's not very many platypuses out there. And that is the platypus of autoimmune. So for a lot of people, they're looking for this root cause. A lot of them think diet is the root cause, which it's not, and the research supports that. And we can talk a little bit about that. But for a lot of people, they're going on these really restrictive diets. They're doing all this testing. There's a time and place for testing, but the limitations with testing is you're testing a small parameter. Half of them don't even have evidence behind them. They're just fancy little tests that cost $5,000 or $500 that don't actually change your outcome, your clinical outcome. A lot of the research showing on supplements, which you had brought up a long list of supplements, I 100% agree. Some of them, like zinc, for example. So the research shows that all these people are deficient in these supplements, but the research doesn't support that adding those supplements actually change the dial for autoimmune, which is, so yeah, you may have low zinc, but it's actually how the body is using that zinc. It brings it intercellular as opposed to you needing to supplement to actually make it better. So when we start to look at the research, and right, it is, you are going against the grain with evidence-based for sure, but treating root cause it creates so much stress. There's never usually one cause, which is what people are always looking for, is that one thing. Was it that burger that I ate last week, or like all that gluten that I ate when I was on a breakup with a boyfriend that spiraled me down to this? No, it's not. Chances are it's your central nervous system. Could be something that happened as a childhood. There's a lot of research supporting advanced childhood events, ACEs, that actually change the way your body responds to stress. There's probably a multitude of reasons why you've got this. Genetics is about 30%, but moving and changing your lifestyle will help. It doesn't necessarily mean it's the cause, and you're not going to necessarily find that one root cause. So yeah, it is an uphill battle.
It is. And I think too, like you mentioned the shame piece at the beginning, like the more emphasis we place on trying to find the root cause of someone's illness, the more like maybe backhanded emphasis we're placing on that person as being the response, like bearing the responsibility of having that autoimmune condition.
Right.
And it's not, like, I agree with what you said there. It's maybe it was the infection that you had, that third pregnancy, right? That your immune system started to, shift in a way that pushed it towards autoimmunity, or there was an impetus that, triggered that tendency towards autoimmunity. But finding that needle in a haystack, first of all, doesn't change what we do with you as a patient, right? So whether we think it was your Epstein-Barr infection or your third pregnancy, I mean, we're not going back in time to undo that cascade of autoimmunity that's happened. But like by proxy, we actually start to place blame on the patient if we have this like relentless pursuit of the thing that caused your autoimmune disease. And especially, like you mentioned, how so much is focused on diet and lifestyle. And really, that's not really an empowered way to support people in thinking about their healthcare. I think it's a much more positive thing to say you have an autoimmune disease. We don't like, it's almost like therapy, right? Like we don't, maybe don't need to go back and look at like all the things that happened back there. Why don't we talk about like how to move forward from this moment actually?
Yeah. I love that conversation of like, okay, so these are the things that could have been associated with it. And that's where a lot of the research doesn't support that these things are associated, doesn't mean they're the cause, and doesn't mean that correcting them actually does help the condition. And so I think that's a really big distinction that you just made there. And moving forward, absolutely. So for example, you've always been a nighthawk and you're not getting your sleep. How can we shift that? How can we help that nervous system come down despite what's happened in your past? Like, how can we start to correct some of these? And this is where, like, there's a lot of really great research out there that shows, I want to share one with you because I thought this was so fascinating. And I don't know if you have read this one, but there was a really interesting study. It was a randomized control trial done in Mexico on a Mediterranean diet and exercise. And do you know what had the best? So they had 4 groups. One was Mediterranean and exercise. One is Mediterranean only. One was exercise. And then one was control group. Do you know what group had the best outcome after 24 weeks? It wasn't the diet group. And Mediterranean diet has a lot of research to back up for autoimmune. It's one of the best ones out there for autoimmune. It was the exercise group. The exercise group had the best clinical outcomes in that study. And so if you can start with that information, if you can make some slight diet changes to get more on top of the Mediterranean diet, because it does have some really good research, but move your body, oh my goodness, what difference that can make in rheumatoid arthritis. Like, it's so fascinating. So I love that point of like moving forward. What can we do? How can we empower you to really help? Now, one of the big things that they point out in all these studies is that accountability needs to happen because it's a high dropout rate. And that's what we're finding with diet too. I think when we're talking about the diet, there's so many people going on these crazy restrictive diets and are stuck on them that can't get off because their condition flares because they haven't addressed all of these other things that are actually going to help move the needle so they can eat food. Like, fasting is great and it does have some good research, but you can't fast forever. At some point, you're going to have to eat food. And the research shows as soon as you put in a healthy vegan diet, disease flares up. So addressing some of these underlying things that are not in check are going to make a really big difference on how you move forward with this condition. Because like you said, we can't change the fact that you got diagnosed. Postpartum prolactin levels are a huge factor for diagnosis of autoimmune. Was that the root cause? Possibly, but what can we do about it? It happened. So now we can move forward with all these lifestyle changes that can move the needle, that have shown to move the needle.
And I think what you're seeing there too, and we've talked about this in other episodes around chronic conditions like acne and other things, is that, again, that relentless pursuit of cure also starts to place a lot of blame on patients. And I will meet patients with autoimmune disease, since now I will occasionally see patients with autoimmune disease since I've become less fearful of it, where they say, well, if I could just, right. And then they fill in the blank for all of these things that they feel like are expected of them as an autoimmune patient. If I could just eat cleaner, if I could just remember to take my supplements, if I could just, and it's like they list off all of these obligatory pieces, then they feel like the outcome they're going to achieve is a cure. And now they've made themselves and their ability to comply the thing that's getting in the way of their, the pursuit of cure. And that's a hard conversation to have with them as a clinician, saying, actually, like, lupus is something we manage.
Yes.
Hashimoto's is something we manage, right? We may have moments in your, disease history where things are better or worse managed, but we're not going to take it back to this cure point where we're, ground zero and no longer have this tendency or this diagnosis. And even just that little bit of information, almost gives patients a bit of a permission to try and live a little bit more of a normal life and to have less shame.
Yeah, absolutely. And I think the word cure, well, definitely with autoimmune, it's like we've redefined, or at least the conversation I've had with a lot of my clients is, what is remission? Is remission possible without medication? For many, no. At this point, definitely for some, not at this point. And the amount of people that have come off medication and just been like, hey, by the way, I came off my medication, and they're flaring. The research, one, I think there's an ethical component, is they can't do research and tell people, hey, come off your medication. Let's see how turmeric goes against no medication, right? Like, that's unethical. So at this point, there really isn't a lot. Like, people are coming to me looking for a natural approach, as in replacing pharmaceuticals, and that's not reality. There's nothing to support that can actually happen. So the conversations that I'm having in clinic are completely different, along the same lines of, how can we manage this? And especially too, can we get it to the point where if life does get crazy, you don't spiral down, right? Like, that's it. So the conversations that I'm having in clinic are so different than the conversations that are happening online. And I actually just did a podcast episode on this on my podcast about what is remission. Let's redefine what remission is. Remission should be something that where you are with medication in a really good place with great quality of life. Like, that's ultimately what it is the quality of life. And for a lot of people, there's a lot of shame about taking medication when it's actually helping you tremendously. You can't do this without it. It's a hard conversation. It's a hard one for people to wrap their head around. But I think it's definitely worth having with your practitioner as well, as opposed to just going along hoping that it's going to get better.
Mm-hmm, mm-hmm. Yeah, those are such great points, Alison. And I think too, and we don't often do a great job of explaining, and I say we, not like you and me, because I feel like we do a great job at this, but we don't do a great job, like in medicine in general, talking about the consequences of inaction.
Yeah.
Right. And so,
Absolutely.
and yes, you're right about the bazooka. Like, a lot of the medications that we're using to support patients with autoimmunity do feel like that sledgehammer approach, which, I think can make people feel a little gun shy about looking at conventional medicine options, especially when they've had a 2-minute appointment and they get given a piece of paper for medication and a follow-up in 6 months. We'll often see those people land in our office and say, well, I was told to take this, but I'm not so sure. Right.
Yeah, absolutely. Yeah. Well, and I think that's where collaborative care is so beneficial. So beneficial.
Yeah, because what we're not doing is explaining what happens to those patients if they don't do it.
Right. And but I think that's where collaborative, so you're getting your medical doctor's perspective, and they're coming to us. And the conversation that we need to start to have as naturopathic doctors, as integrative care, is to support that. This is what the research shows is the best approach. Turmeric is not going to do it. It's just not going to do it. It doesn't do anywhere close to what we need with that. Turmeric on top of your medication, now that's a different story. That's a different conversation. But coming to us for an alternative approach, yeah, not at that time of this is, and the research, so a lot of it has changed with rheumatoid arthritis in particular. In the last, 5 years, maybe 6 years, maybe even longer, is now, and this is why they've changed how quickly you can get in and get medication, is because they're seeing the earlier that they can medicate, the less damage. And guess what that means? A better quality of life, like for so many people. So I think I think we've really done a disservice in saying that, there's a natural approach. Mm-hmm. There isn't.
Because it's funny, because like for most other conditions, you will hear patients almost say with pride, like, well, I didn't take an Advil until it got really bad. Right. Or I didn't give in and take my medication for that day. I waited until it got really bad. Whereas with autoimmunity, this is actually, it's quite the opposite, right? Absolutely. It's like the earlier we intervene, the earlier we support, the better we do. The goal isn't to see how long we can delay or put up with the lack of medication. It's how quickly can we get you accurately supported and assessed and get the right medication and then support you on it, right? Which Absolutely. Is a totally different, way of looking at many conditions, or so many conditions. We've got this almost martyrdom approach where, we're congratulating patients for avoiding a painkiller or avoiding their antihistamine or what have you, when this is like the complete opposite mindset, actually.
Yeah, absolutely. And I've had those conversations. I like the way that I treated autoimmune is completely different than the way that I treat now, especially diving into the research. And so when we're looking at that, and actually I think it's just getting working with a number of patients and realizing this is actually the reality of it as well. And so my conversations in the last 3 to 4 years have definitely changed. And I think it has to change because, well, I know that there are different models of medicine that are out there that are more of a natural approach, but it's not supported. It's not supported in the evidence at all. And so I think as a whole, and this is one of the reasons why I'm doing a rheumatoid arthritis module, 5-hour course for practitioners. And this is why, is we need to change the conversation. One, we need to be less fearful to treat these people because there's so much that we can do. And so if you're listening to this as a client, there is so much that we can do in conjunction, but not instead of, is I think the conversation that we need to have. Well, I know it's a conversation that we have to have.
Yeah. And for clinicians, even just having the confidence to stand in that, because, I do think the tide is shifting there's definitely a large group of integrative practitioners that recognize where the evidence lies and are willing to take that science-based and collaborative approach with conventional care. You'd be less of a black sheep standing with that group, led by you than it maybe was 10 years ago, for me staring down the autoimmune research going, I don't think turmeric's going to do anything here.
Definitely not alone. Definitely not alone.
Definitely not alone. And so for our listeners, Alison, like just to switch gears for a second, like I'd love to know sort of what those pillars of health actually do look like for a patient that is struggling with autoimmunity. You've kind of made mention to things like movement and nutrition and then habits. Like how can people start to get to helping themselves towards taking control of their autoimmune disease?
So there's a lot of variations or a lot of lifestyle factors that play into it. So we know what some of the new research that's really coming out that is so fascinating is looking at the central nervous system. So I used to at one point think, oh, it all starts in the gut because that's what we were told. I did a lot of functional medicine training and that's the motto. It all starts in gut. No, it doesn't. It actually, for many people, it actually starts with the nervous system. So looking at that, supporting that, looking at how you are responding to the environment, HRV, so heart rate variability is a huge factor. In fact, they're using that as an early predictor of whether you're going to develop rheumatoid arthritis. So they're starting to now look at that. Hormones are a big factor in this. We know that. That's why 70% of the people with autoimmune are women. So balancing hormones, looking at that. Adrenals, so the HPA axis, so adrenal health, some of the research is supporting that autoimmune people are blunted in that. That's why they're not getting that anti-inflammatory impact. So looking at supporting that, gut health definitely is part of it. It doesn't mean it's the whole thing. And once you fix the gut, it's better. But it's definitely something that we want to make sure that you aren't having chronic diarrhea or you are moving your bowels every day. So we want to make sure so just looking at the whole picture. Sleep is extremely important. That's one of the first things that they notice changes with people with autoimmune, whether it's due to increased inflammation, we can reduce inflammation. There's so much that we can do from a lifestyle and a supplement point where you're not taking 500 supplements. I have a rule, I have 5. I don't ask my patients to do more than I can handle. And I can handle 5. And so if my patients want to do more, that's fine. But I have a rule. I like to keep it at 5. So I try to pick 5 of the best ones for these people that are going to move the needle. And so something will probably support inflammation. Diet, Mediterranean diet, that is actually where the research supports it. Eating more fish is going to make a big factor in this. Getting better quality sleep. So if that means that you need earplugs, you need a sound machine, you need something, if you're not sleeping, it's going to be hard to move forward. So all of these different things, moving your body, that is where the research shows is almost the best outcome. Yoga, mindfulness has some tremendous research behind it that you can start doing right now.
Yeah, I've spent lots of time on that research. No, I love the excitement's good. It's going to pump people up. I love that conversation about exercise and autoimmunity because, but this was kind of lead into my next question about, how important that relationship-based care and coaching and support actually is. Because, one of the things I think our patients struggle with the exercise piece is that they don't always feel like doing it, right?
Mm-hmm.
Whether they feel a limitation from joint pain, whether or not they feel a limitation from fatigue, they may or may not have had an exercise program prior to diagnosis. And so then certainly it feels like a mountain to climb over to try and create an exercise program after a diagnosis. And yet the research on what happens in the body of people who moves is so profound.
Yeah.
And the reduction in fatigue. And I love looking at that literature on lupus and exercise, where, part of the reason those patients are so tired is because of the inflammation, not because they're not capable of exercising.
Yeah, absolutely.
And then moving their body actually helps to dispel some of that, not only that inflammation, but it also helps your brain feel more energetic, right? For lack of a better word, because when you move your body, you're actually proving to your brain that you do have the resources to exercise. It's so fascinating to me.
Well, and the adrenaline, like there's so many other chemicals that happen when you move your body that actually help reduce pain and fatigue. And eventually you get to the point where you're getting almost like a workout high. But it's getting to that point. It's creating those habits. And that's, I think you had mentioned that in your lupus research when you're talking about this at one point, is getting those accountability in there. And so the check-ins, the frequent check-ins, and maybe that's with a health coach. I think the way that you do a lot of your exercise, I think it's brilliant. Like, you have a coach, you pay a coach. So for the rest of us, I was actually just percolating on this weekend after watching you lift all these incredible weights and achieve all these things. And like, I actually don't have anyone that I'm accountable to for exercise. And I think that's a really valuable thing, especially knowing that's one of the biggest things that moves the needle. So for a lot of people, that's simply hiring a coach, if it changes the quality of your life, could be beneficial.
Yeah, I think that you're right. And it's interesting, when I was listening to you talk about all the areas that we can focus on that help support an autoimmune patient, really, there isn't an area of health that doesn't need to be looked at or addressed. And even that, we kind of opened with, we don't want you to feel overwhelmed. You don't have to look for the cure. You don't have to look for the root cause, but there's 10,000 things you can do that are super helpful. I'm recognizing that dichotomy a little bit there, that like, we don't want you to be overwhelmed, but there's a million things you can do to support yourself. I think the bridge between those two pieces is having the support of a person who can actually help you understand what the priorities are, or understand what your next move should be, or troubleshoot for you. It's funny, even I had a check-in with one of my people on my team this morning, and I don't take in my supplements regularly, right? And so we literally spent 10 minutes trying to strategize how I could take my recovery supplements more consistently as I get ready for my next weightlifting competition. I need that, right? And so to think that, like, as a person who's been recently diagnosed, has the grief of coming to terms with or understanding their diagnosis, leaving a 3-minute appointment with a piece of paper that they don't understand. Like, really, this is the setup for inaction, not action.
Yeah, absolutely. Well, and I will say, I didn't get through. So here I graduated. I have all the knowledge that I should have to get through an autoimmune diagnosis. And I actually had to work with my own practitioner. This is something, and I think for a lot of us, we don't realize this may not be the DIY project. So there's so much information out there. Not all of it is relevant to you. And that's where I think a lot of people are like, well, I need to do this, I need to do that, I need to do that. Maybe not. Maybe not. And I think that's where you, like, having the coach support. That's why I tell people I'm your Sherpa. The information is out there. I'm just going to tell you what is relevant, what we need to do, and hold you accountable to walk you through this. And like I said, we can go straight up that mountain, or we can go around and do the scenic route. It's your decision, because this is your health journey. But I couldn't do it on my own. I couldn't. I needed someone. The other thing too is, when you're in the forest, you can't see the forest because of all the trees. Like, you are looking for that one thing that caused that flare, that caused that trigger. Whereas when you're working with someone, they can actually see the whole big picture. They can put it together. They can tell you, okay, this is actually where we're going to start. We're not starting with gut health. We're starting over here with your sleep, because if we get you sleeping, we're going to check all these boxes. And within 3 weeks, you may be feeling so much better. So I think that's the big thing, is mapping it out. But the support, you can't do it alone. You can't.
And so for you, I mean, you work with autoimmune patients, and we'll explain where people can connect with you in your podcast in a second, but you've also started to transition to supporting clinicians, which I mean, everyone knows that I am incredibly passionate about, not just changing the lives of each of my patients, but also the lives of other practitioners' patients, by helping support clinicians with evidence-based care, and also resources and an entire database really of evidence-based integrative support. And you have taken this on as a project as well over the last year to support clinicians in their own practices with their autoimmune clients, so that they can get the kind of outcomes that you get with your patient population. We have an upcoming course for practitioners on autoimmunity. Like what drove you to want to work with clinicians, Alison?
So my goal 10 years ago, when I shifted to autoimmune, was I wanted to go to every autoimmune conference. I wanted to know everything there was to know. So I started going to the conferences, and I'm like, well, I could teach that. But I just wasn't satisfied with the information that I was getting. There were some really great practitioners out there sharing their autoimmune information, but the evidence was a lot of rat models, which don't necessarily translate well into human at all.
Unless you have a rat with lupus,
but it's not even lupus, because we're inducing it. So it's not even, like, did that rat naturally get lupus? No, it didn't. Same with MS. Like it's when you start to read it, you start to. So anyways, it wasn't the information that I wanted. And so I wanted, a year ago, when you were talking about the expert clinician, I'm like, I want to create the autoimmune course that I wanted 10 years ago, which is, here's the evidence, here's the conversations, here's how we do collaborative care. I wanted that course, and I actually did it for selfish reasons as well, because I was going to dive into the information anyways. So why not share it with everyone, and just make stronger, better clinicians, so people with autoimmune are having a better journey. And I am going to so I will be doing a 1-day course for patients, or a 4-hour course of the information, just at a different level. So you don't need the collaborative care information, all that, but I will be sharing that as well for anyone who can't work with the doctors that we are training in this coming October, because this information needs to get out there. The conversations need to shift and change. So patients feel empowered and realistic about what they can actually achieve. Sometimes it is shocking when you sit down and have a conversation with me, and it's like, well, but I wanted a natural approach. But that's not possible. That is the unicorn for some people, for most people.
And I think for patients and clinicians, it's an important reminder that all of those things that you want to try, all those diets you want to do, all those supplements you take, whether they're prescribed to you by yourself, or, you found them online, or whether they were prescribed to you by a practitioner, you end up taking that treatment plan into your specialist's office. And that's not to say that, you should make peace by, you of course advocate for yourself. And of course, we want you to be doing things that maybe your specialist doesn't know a lot about. But you want that treatment plan that lands in your specialist office, that's been recommended to you by your practitioner, to be one that they don't disagree with. Right. And one of my favorite parts about collaborative care is when I have a rheumatologist say, I want you to go see Jordan. Right. Or, yep, that's great. I'm glad you have someone that's working with you on that aspect of your care. That's not my wheelhouse. But when we take these treatment plans, with like 15 supplements that have mostly been studied in rats, and really strict dietary guidelines, and you start asking, your rheumatologist about whether or not they're going to test you for the root cause of your disease, all of a sudden you're not speaking their language. All of a sudden we're creating these teams on your healthcare rather than one team in your healthcare. And really my goals by providing clinician-based content is that I want integrative practitioners to sit at the table with specialists and have better patient outcomes by working together rather than being on opposing sides. And I'm really grateful for the work that you're doing, Alison, because that is exactly what we're achieving through your courses.
Yeah, absolutely. Well, and really it's not just providing treatment plans, but the evidence isn't to back it up. It's just it's practice. It is practice. Like you don't have anything to back that up. So thank you. I appreciate that. I am really excited to launch this and get this going and impacting so many people's healthcare and just make it a better journey. Like my mission in life is to make the autoimmune journey less overwhelming, less fearful, and just a better experience for everyone.
How can our listeners find you? And we're put links to everything in the show notes. So if you're hearing something here from Alison or myself that you're like, yep, I got to participate in that, or I want to forward that to my practitioner, all the links are going to be in the show notes. But where can our audience members find you?
So probably my most active is Instagram, and I'm starting to rev that back up again after a little hiatus in the summer. So Dr.Alison Danby, and you can message me on my website if you want to work with me on the website. If you want anything to do with the one-day intensive that we have coming up, the links will be on Instagram, and you can reach out to our website as well, and we'll have the links in the show notes.
Awesome. Thank you so much for sharing with us today, Alison. You have such, I was about to call it a unique message, but I actually think it's going to be the dominant message in integrative autoimmune care over the next 5 years. And I'm excited to watch you pave the way.
Thank you. Thank you for letting me share my message.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.